Welcome back. You're tuned into Inspired Afternoons with me, your host, Mariam Mia. And next up, we're discussing Community Home Oxygen Initiative. And this initiative, it's an amazing initiative. It's already started in Lenasia and under the guidance of one of the medical professionals who is part of this is Dr. Fatima Lambert. And she completed her undergraduate at the studies at the University of Witwatersrand, specializing as a medical doctor. Thereafter, she specialized in anesthesiology through the University of Witwatersrand. Subsequently, he has done a fellowship in intensive care, currently working private practice and part of multiple COVID teams and forums. She's always had a passion for helping the community, and this time, uh, the COVID pandemic has given her an opportunity to assist the community in Lenasia as well. And then joining her alongside her is another specialist anesthesiologist. Her name is Dr. Zeenat Dadabhay. She, with a number of other doctors in the area, are increasingly alarmed at the shortage of hospital beds as we steam towards the peak of this crisis. Inspired by the SIMS model, which we will be discussing soon, we're starting a similar home treatment program in the green site surrounding areas. And this consists of oxygen therapy, nebulizers, medication, medical advice, and community awareness. So basically, these medical doctors, in fact, I say they're visionaries in ahead because they foresee that currently hospitals are to capacity. There are not beds available. I myself had the experience 2 weeks ago where we battled to find a space at a hospital for a family member. And as we reach the peak, hospitals are going to become full. But these medical doctors have now seen that patients can be treated at home with the correct equipment and resources. So let me just briefly explain to you from this home care oxygen initiative. It says the sub-medical, comprising medical professionals from our immediate area. The objectives were many. First of all, education is a big focus and is ongoing. The availability to our community and broader area was imperative, especially with persons being encouraged to stay at home and to call their doctor. Collaboration with the Lenasia Disaster Forum and other community role players has been key. SIMS Medical and SIMS IT has spearheaded the creation of the Lenasia Medics Directory for COVID-19, providing quick and easy access to details for 70 plus medical persons across Lenasia. Their availability via WhatsApp, video consulting, as well as their geographic location. Our team of doctors, specialists, pharmacists, donors, and some staff team leaders have attended to persons needing medical advice and treatment and also made provisions for medical packs for symptomatic persons at home at no charge thanks to donors. Significantly, the team ensured that the local hall was made available for the first community-based SARS-CoV-2 testing station. This was made available to Empath Laboratories, and the partnership has proven to be a safe and convenient place to get started. Home-based oxygen provision. As general hospitals and ICU beds fill up, hospitals will be on divert. The ability to provide oxygen to specific patients confirmed with COVID-19 meeting specific clinical criteria at home will be beneficial and often life-saving. So the plan is, wait, let me leave it there because we can hear directly from the doctors what is the general plan and how they plan to roll this out and what are their requirements in terms of community support from the surrounding community. So let me just welcome, Assalamu alaikum, Dr. Fatima, welcome to Salam Media. And
Walaikum salam. Jazakallah for having me. Such an honor to be introducing what we have been doing from the time of the lockdown. Do you want me to proceed?
I just want to welcome and bring in Dr. Zeenat Dadabhay, and then we can proceed. Assalamu alaikum, Sister Zeenat, and welcome to Salam Media.
Wa alaikum salam. Jazakallah for having us, and as Fatima said, for giving us this platform.
We must thank you because I felt Zeenat in the Greenside Emarentia Parktown area, she's been our go-to medical expert. So I think yours is more organized, Dr. Fatima, but Zeenat, I think in our ego level, she's been there as a support to the local community in terms of the information, the correct information going out there. Because, you know, in the time of false information and panic, it just takes one post to get everybody anxious and everybody nervous. So Dr. Zeenat in our community has done sterling work in terms of damage control. She and I always consulting in terms of getting the correct factual information out there. And I know in communities like Lenasia also, just one false email, you know, there's pandemonium and panic amongst the whole community. And I think that was one of your challenges is education, education, education. So let's just focus a bit about that from both the doctors, and then we can discuss this latest initiative, inshallah. Dr. Fatima, you can go ahead.
So what happened was during the lockdown, a group of community doctors, community police forum, the Lenasia Disaster Forum, medical professionals, ambulance service, funeral parlors, we all got together already just before the lockdown. We had a meeting and we predicted what is going to happen in the future. We knew that there's going to be a rise in the COVID-19 infections. We also knew that our already stressed healthcare system is not going to manage with us. And we already knew that in addition to that, there's going to be people in the community who are going to be starving because we knew no one's going to give them food despite the promises from government. So us as a community decided to get together and we divided ourselves into medical professionals, and we have a Lenasia medical directory. So it was easy for the community to access medical advice, especially to the COVID, because they can be COVID patients and they can be non-COVID patients, and everyone needs to be seen to. So we had that in place. Then we had some food management. So they went to all the houses which are more poorer. We had some elderly, so they looked after the elderly, made sure that the elderly are okay. We had the funeral parlors and the ambulance services. The funeral parlors, we went to go show them how to PPE don and doff. We went for quite a few hostels there. We helped them with that. So we were organized from the beginning of the lockdown. So essentially now, and then we had our some medical team which started our oxygen-based home therapy, because we knew, because as an intensivist, you know, there's stuff that can be done. And for this actual virus, you don't just need to intubate them. The virus affects your lungs, which is important for oxygenation. If you get these patients early on in the disease, and if you can give them oxygen early on in the disease, as well as letting them sleep on their stomach, blowing balloons, all of that can help, and we can save more lives than have deaths. So because we were already organized from then, our system is rolling quite well here in Lenasia. We have helped quite a few people here in Lenasia.
Mashallah, just thinking back, you know what, you took this initiative along with your fellow medical doctors in a team. Like you say, it's a interdisciplinary health professional team, as well as your community leaders, and you formed a partnership by existing community structures in the community, and you have a holistic, comprehensive plan. And I'm so pleased you have like a plan of action. So even when we reach our peak, and now it's saying we doubling, and the amount of people that are testing positive is increasing exponentially, you are able somewhat in terms of handling the capacity and now focusing on home-based care in view of the fact that we're not going to be able to hospitalize everybody. So I know, Dr. Zeenat, this has been a passion of yours, and you've also been very restless in terms of wanting to adopt a similar model in the area just north, just past Mayfair area. So it's basically Greenside, Emerentia, Parktown, those areas, because basically, although the proximity of Joburg, Jane, and Mill Park, and Garden City, and Park Lane, these hospitals are very close by, but the reality is there's no beds. That is the reality. So I know you're very keen to adopt a similar model in those areas. Tell us, what is your intention and how do you intend to roll this out?
Okay, so just to start with, you know that since the beginning, as you've mentioned, we've tried very hard. We've had a lot of emphasis on the sort of community information and trying to get messages out to the community. Initially, we spent a lot of time trying to promote the prevention. But as this has gone on, we've realized that numbers are increasing and something needs to be done. So a couple of my colleagues saw what they were doing in lanes, which, alhamdulillah, they very organized, they were very visionary, and they had things in place before we reached this phase. I think maybe in our areas we're a little complacent. As you've mentioned, we've always had so many hospitals around us that we were maybe a bit comfortable and complacent, thinking that there'd always be a bed. As this has gone on, we've realized that this may not be the case, and our numbers in Gauteng are increasing alarmingly. So not just myself, we are a group of doctors in the areas that's got together. We've got general practitioners like Dr. Yumna Hassam, we've got other specialists. We've spoken to Atya Mosam before, Shireen Doda, and then we've got a team of physicians as well. And we all got together along with a local pharmacist, and we looked at the SIMS model and said, how can we implement something similar in our area? Unfortunately, because we were playing catch up and we didn't have all these programs in place before, we're now focusing on the education and on the provision of home oxygen service, and how we can look at what our colleagues are doing in lanes and adapt that to reach more patients at home. Because as we've mentioned, there may not be a bed for every patient. There's also going to be patients who need to be discharged from hospital prematurely, who may still need to be supported at home. And then we can help as well the mild patients who don't need hospital or oxygen by just giving them information, what they should be doing at home, what household contacts should do, getting the right doses of the basic vitamins that we're using to treat, like the vitamin C, the vitamin D, all of that, getting a pack with the right doses available so those patients can ask for it, and just being there for support and counseling as well. So that's what we're looking at rolling out on our side.
And I think the main thing is in terms of your human resources, in terms of your knowledge and visiting patients and conducting home visits, that is all in place, and that you have you've already have in many cases volunteered your time and services in that capacity. But I think where you need the community to come, community support and assistance in terms of purchasing this equipment, because this equipment comes at a cost and it's life-saving equipment. And the reality is not everybody has access to medical care, medical insurance, and oxygen, could be a matter of life and death, and getting this in. I think that is one of the, your focus is, if when community say how, or members of the community say, Dr. Fatima, how do I support you and your team? Dr. Zeenat, how do I support you and your team? The best support is if they can help you in terms of an investment in purchasing the equipment that you may need to save a life. And I think, what, that is your sadaqah in terms of how we can best support you. Am I correct in terms of that? For now, is that one of your main needs currently? Dr. Zeenat.
Very well put, Mariam. I think especially for us getting off the ground, we need to look at procuring all these machines, the oxygen concentrators, and then there's a lot of things that are disposable that you can't reuse. So getting the personal protective equipment to the houses, getting the right masks and nasal cannulae to deliver the oxygen, those sorts of things are going to be ongoing costs. So it doesn't mean that if we buy a few of the oxygen machines, it's done. There's going to be a few things. There's going to be a lot of ongoing costs. So we do need help from the community in that way. And I just want to clarify, when we say community, both of our models are not restricted to the Muslim community. We exist as a part of a bigger community. And Fatima and them also in lanes, we exist as part of a bigger community. So we're looking at serving the communities in which we live and operate.
In fact, in Lenasia, we have two teams, because Lenasia is such a big and widespread area. So it's Lenasia and Lenasia surround. So we have the SIM model, which is a few of us, but we do, if we have extra oxygen concentrators, we go out of that. And we have the Lenasia disaster fund. So there's actually two teams that we have that are available to the community. And as Zeenat said, it's not only for the Muslim community, it's for the whole community. What's very important to get out there, though, is that we were very visionary, and therefore we got the oxygen concentrators early. But right now, oxygen concentrators are getting depleted, and as we go on, it's going to get even more depleted. So people, if they can open their hearts up and donate to every community, whoever is trying to replicate our model, it will be of great assistance to everyone.
Uh, Dr. Fatima, so that's why I'm going to ask you, can you just give us, just for myself in understanding in terms of cost-wise, as well as for our listeners out there, so whoever wants to donate, we sing, I mean, in terms of what is the cost in terms of what you need. So let's just say, for instance, you are able to care for somebody at home and you've done a consult, you've consulted with maybe a physician as well in there. So is it only oxygen they need? Obviously, you will need personal protective equipment yourself when you're going there and then. So what is the, like, what do you need and what does it cost to treat a patient in terms of the resources?
Okay, so firstly, you'll have an oxygen concentrator. An oxygen concentrator is a machine. It's very simple to use, and it's to provide oxygen. Okay, so they come in two sizes or three sizes. The one is a 5 liter, the one is a 7 liter, and the one is a 10 liter. Right, and depends on how much oxygen the patient needs. That's how much we're going to give them. A 5 liter roughly costs around 10,000 to 15,000. In fact, we bought ours for 15,000. And then a 10 liter costs around 28,000 rand just for one oxygen concentrator. And a 7 liter is going for around 7.5 to 10,000, but even those we have to wait for 2 weeks, and by that time it's going to be too late. So currently we're trying to source out even a 5 liter, even if it's 15,000, we rather source out 5 liters now and have that on hand than wait and it's going to be too late, because I feel we're already in our peak. The peak is here and we need to start acting now. Then another thing that the patients need, not all, all patients need a saturation probe or a pulse oximeter, and that goes around roughly 300 to 400 rand. Each oxygen concentrator must have a saturation probe, because otherwise we won't be able to monitor the patient. A nebulization machine is a machine in which we give them medication to open the airways. And I know there's this misconception where people say do not use nebulization. Nebulization does cause the virus to spread. We call it aerosol generating. But if you do it in your room, isolated, and open the windows and be well ventilated, you can use it. In fact, a lot of my patients needed nebulization. So that's very
So
important.
Dr.
And
Fatima,
while
just to
you're
interrupt, so regarding those nebulizers, so if you do it as mentioned, well ventilated, the patient is isolated, then the pros definitely weighs up the cons, and it's actually
exactly,
beneficial to then nebulize. Okay, I
exactly.
just wanted to get that correct information, because as Zeenat and
100.
I will know, the jury will be out. If somebody says nebulize, you're going to get 20 other messages
I
as well as
know,
articles about how
I know.
bad nebulizing is, and you're going to have a spike in this and that. So that's why I just wanted to clarify it on air. If it's done correctly, then there
If
is,
it's done
you've
correctly,
seen definite
I
beneficial
think,
results.
beneficial
You can
result.
go and add to that, Zeenat.
sorry, I think that this just, everything with COVID just comes back to getting clear and the correct information across, and being very meticulous about COVID patients isolating. So wherever it is, it's in your home, you're sick, you're nebulizing, you're not. We need to take this isolating thing seriously if you suspect it or you have COVID, and particularly if you're doing things like nebulizing.
Okay, so perfect. So, Dr. Fatima, what I need to, and Zeenat yourself now, in terms of this model, you know what, like you say, it's tested, it's worked, other
Beautiful.
areas in communities. So if each person in a community, so for Lenasia, they can, is there a specific contact detail that the community can go in terms of supporting and sponsoring by way of donation in Lenasia?
Yes, I have two flyers that I can send to your producer, and maybe you can put it up on your website. There's also other areas that are also wanting donations. I think the Mayfair
Yeah,
area one. Yeah.
Okay, I've got another one in Durban. Zeenat, let's go to you. So, I in terms of the area, let's just say North area. That's Parktown, Greenside, Emerentia,
Yeah.
London, Victory Park, Northcliffe. I think I'm looking at the geographic location. I think I've covered in terms of that. So, how do we contribute and who do we contact? If anybody listening out there would like to contribute and contact, who do we contact?
Okay, so just to clarify quickly, we've defined our areas for now as Greenside, Emerentia, Victory Park, Linden, Montgomery, and Roosevelt Park. And as we get donations and get more machines, etc., we can hopefully expand, or other areas can expand. And just to clarify also, and other areas that are also doing it, I think Lakefield in Benoni, for those around there. I know Roshni's got an initiative. So in your area, you can check what's happening. I'll give you contact details as well. We've put out WhatsApp messages, a community information brochure, and a poster. And those of us that are involved are more than willing to field your calls and your emails, give more information of how it works. The IMA has come on board, the Islamic Medical Association, to assist us. We didn't have pre-existing bank accounts. We weren't a pre-existing organization. So they're lending us a lot of support, and we facilitating the finances through the IMA. So your donations are not going into anyone's pockets. They're going to the IMA reference for us, and they'll channel that back as we need it for procurement.
Okay, perfect. So anybody would like to contribute? I think the best way is check out with one of your local GPs in the area, and they would then direct you, because I'm sure you have a network. So, Sister Zeenat, in your area, most of the GPs around will be aware of the initiative. Likewise, Lenasia, likewise, Benoni. So, if your GP is not directly involved in this, they will then pass on your details or give you the details of the GPs and the other health professionals that are involved in this.
And the IMA is also trying to keep in contact and keep everyone's details. So even if they contact the IMA offices, they should be able to put you in touch with one of us.
Perfect. And then I've got I've got one now. They came here for Durban as well. So whoever's listening out in Durban and you'd like to sponsor a unit of oxygen concentrator, it's Sister Shaida on 072 738 6204. So this is for the Durban area as well. So please contact. Let's keep it local. As the Ahmed Kathrara Foundation initially 2 months ago said, you know what, it's all about care and community action networks. So support your local community initiatives. At the end of the day, you could be saving your neighbor's life, because as we know, Islamically, our neighbors have rights over us and we have rights over neighbors, and your neighbor is essentially your family. So you might not know that money you had contributed for, down the road, somebody might need assistance. And alhamdulillah, how fulfilling it will be that you feel, you know what, I can't visit my neighbor physically, but alhamdulillah, the money I contributed towards an oxygenator is now actually helping your neighbor breathe. You're giving me a gift of oxygen, a gift of life. So Jazakallah for joining us.
Because the SUM model was actually based like this. And that is why we started it so quickly. And so it was for our community, and then we expanded and expanded. And because we were so quick on to act in everything, and we were so united, we could do that. And now we can expand because it was actually for our region, and now we expanded. And then the Lenasia Disaster Forum also, they expanded because we started it for our community. And if it starts like that, it can definitely expand.
And that is the Islamic concept in principle. If you look at, alhamdulillah, how Medina started in terms of an Islamic society, everything was community based. The masjid was the hub of the community, and whatever happened, it was a community. So they didn't look at themselves as individual families or clans, but the whole community was your family. And especially in a time like this where we are physically distanced, we still can keep together, because if we can come together and serve our community, we will still maintain that muhabba and that love, inshallah, and knowing that you make a positive difference.
Yeah, I found more unity in our community. It's so amazing. Whether it be the undertakers, or whether it be the paramedics, or whether it be the podiatrists, or whether it be We all work together, and the only reason our patients are able to get this home-based oxygen is because we all work together. We all pitch in, and we all make sure that this patient is sorted out. So this unity and this harmony between the whole community is very, very important.
So inshallah, I'm appealing to everybody. Please contact your local doctors in the community to find out how best you can support your neighbors in the community, and let's build that sense of unity, muhabba in the community. And I thank you for taking your time in introducing this initiative all all around in terms of care in your community. I know both of you, Sister Zeenat, we know each other because we're from the same community and we work together, inshallah. And I know her dedication to our community, and I can hear it's tangible in your voice in terms of what you've done to just assist the people in your area, in the greater Lenasia area. So may the Almighty reward you, and let me also, on behalf of Salam Foundation and Salam Media, your humanitarian online platform, we'd like to salute you and acknowledge the work you people do. And may the Almighty keep you in the best of health and circumstances so that you may be able to continue serving humanity at large, inshallah.
Ameen.
Jazakallah. And just to say, I think from Fatima and I both, that we're part of really dedicated and amazing teams of colleagues and friends and community around us. So it's not something that either of us are spearheading alone in our communities. There's just amazing teams. And I think it's so beautiful that out of, as you said, out of this physical isolation, we can actually maybe come out closer rather than more separated. And thank you for always supporting us and for giving us a platform to build some awareness on this.
I mean, that is essentially humanitarian journalism. So alhamdulillah, on our side, this is Salam Media's contribution to your cause. And what I'll do is maybe in about 2 or 3 weeks' time, we can maybe just touch base in terms of telling us an update and a progress in terms of how the home care is going. Jazakallah so much for availing yourselves. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam
wa rahmatullahi wa barakatuh.
We're going to take a short break, and when we get back, we'll be speaking to Brother Idris Kamisa on our Educational Insight segment.